Officer, after 17 years of this SNP government, the crisis in our NHS is deepening. Over 820,000 Scots are on an NHS waiting list. People who are waiting in pain are using their savings or borrowing money from loved ones to pay for private treatment. People can't get GP appointments, and 169,000 patients have waited more than 4 hours in A&E for treatment just since the start of this year. And now, because of this government's financial mismanagement, NHS and social care services face a black hole this year of up to £1.4 billion. That has led to the Finance Director of Greater Glasgow and Clyde, Scotland's biggest health board, to warn that spending in every service would need to be reviewed. Our NHS faces the biggest crisis in its lifetime, but health boards are being asked to make cuts across the country because of decisions made by John Swinney. So does he accept responsibility, and what is he going to do to fix the mess he made?
First Minister.
I think it's very important that we have a substantial discussion about the public finances and the context in which we are operating. We are now operating in Scotland after 14 years of austerity. That has put insufferable pressure on our public services. Now, within that, the National Health Service and health services in Scotland have been the best financially supported of any service within Scotland. So Anas Sarwar could come here today and he could ask me about financial pressures on local government. And he would be right, because there are financial pressures on local government. But he's raising with me financial pressures on the National Health Service, which has been the best funded part of our public services by this government. So I think in setting the context for Anas Sarwar's question to me, he and his colleagues have to understand that Scotland is now paying an intolerable price for 14 years of Westminster austerity.
Anas Sarwar.
So look, where John Swinney and I will not disagree is the fact that we need to get rid of a rotten Tory government that has destroyed the UK over the last 14 years. No disagreement on that. But after 17 years of government, always somebody else to blame. How about taking some responsibility for the decisions that are made here in Scotland? Now, the First Minister made no effort to address the scale of the crisis facing our NHS. Instead, he went to his get-out-of-jail-free card with the UK Tory government. His financial mismanagement and the £1.4 billion black hole that this has created will impact on the delivery of every service in every part of the country. And let's just look at announcements in the past few weeks. Inverclyde's out-of-hours GP service has been permanently closed, with patients now facing a 50-mile round trip to access overnight appointments. In the City of Glasgow alone, over 150 jobs have been lost in health and social care services. In North Ayrshire, care homes have been reduced and charges for vulnerable people have increased. And in Edinburgh, unions have warned that social care cuts will mean, in their words, thousands of hours of support will be cut. Hospitals, care homes, prison cells and morgues will fill up as a consequence. So stop passing the buck. Stop looking for somebody else to blame. John Swinney has been at the heart of this SNP government for 17 years. Isn't this a damning indictment of his record?
First Minister.
I will never evade the responsibility for my actions as a minister. Never. It's not in my character to do so. But I will be straight with Parliament and the public in Scotland. And what I've said, and people, if they want to go and look at all the things I've said on the parliamentary record over the last 17 years, they will find me being straight with people about the financial challenges we face. I also happen to have been a finance minister who's balanced the budget on 10 occasions over the last 17 years. And that has involved taking difficult decisions to protect our public services. That's resulted in the National Health Service being the best funded service in our public services. Now, we've also had to take some pretty tough decisions for which I take responsibility, such as increasing tax on higher earners. Mr Sarwar has deserted that territory. Mr Sarwar and Mr Mara no longer believe in that territory. They voted for it once and they now condemn it. Well, how does Mr Sarwar believe that we can invest as much as we invest in the health service today if we are not prepared to ask people to contribute more in taxation, which gives us £1.5 billion more in revenue at our disposal because of the decisions for which I am absolutely happy to take responsibility, because as a consequence of that, we can better fund the National Health Service than if we had relied simply on the financial settlement from the United Kingdom.
Anas Sarwar.
It demonstrates the economic incoherence of this First Minister, that he supports higher taxes for nurses but lower taxes for oil and gas giants making record profits in the middle of a cost of living crisis. Now, our NHS is weaker than ever. Staff are under unbearable pressure and patients are being asked to accept the unacceptable, all because of the decisions made by this government. And as Deputy First Minister, John Swinney cut hundreds of millions of pounds from health and social care budgets. He said he doesn't want to evade responsibility for the decisions he made. So let me remind him of just one group of decisions he made in 1 year alone. He cut £70 million from social care, while people were stuck in hospital unable to get a care package. He cut £65 million from primary care services, making it difficult for people to get a GP appointment. He cut £38 million from mental health services, leaving people in crisis waiting longer to get the help they need. And he raided IJB budgets for over £300 million, the same local services that are facing funding gaps just now. So, John Swinney, don't evade responsibility. Stand up, apologise for the decisions you made and recognise why people across Scotland are asking the question, how can the man that made the mess now be the one to fix it?
Always through the chair. Mr Sarwar, First Minister.
I think it's a bit rich for Anas Sarwar to come here and to criticise me for decisions I've taken when he supports a party that wishes to relieve bankers of the obligation to pay into our tax system by lifting the cap on their bonuses. That is just a ludicrous position. Now, I've listened this morning to the contribution from Keir Starmer in his setting out of Labour's policy position. I did not hear Keir Starmer setting out an uplift in public expenditure as a consequence of 14 years of austerity. I did not hear that this morning.
Let's hear the First Minister.
And lastly, in a situation where and Mr Sarwar's accepted my point that austerity has been a curse in our society, but despite that austerity, resource funding for the National Health Service has more than doubled. Doubled since this government came to office in 2007. We've taken tough decisions to increase tax to invest more in the National Health Service. We have given the National Health Service, made it the best supported financially of all the public services in Scotland, and we are absolutely committed to delivering for the National Health Service. But what Anas Sarwar cannot do is he cannot come here and deny that we have been operating in a significantly constrained public expenditure context, and we have delivered the best settlement we can for the National Health Service.